Hello, welcome to class once again. I remain Dr. Zichiko Kafko. So today we're going to be looking at the axilla and the axillary lymph nodes. And you agree with me that in anatomy we have, different body regions. We've seen joints, we've seen muscles, we've seen organs, and today we're looking at spaces. So axilla is one of those spaces in the human body. So this space is located in the upper limb as part of the a region between the axial skeleton there and the appendicular skeleton. So you can see it right here, located as a gateway to the upper limb. So this is a pyramid-shaped space between the upper part of the arm. As you can see, let me grab my cursor. Okay, so the upper part of the arm and the lateral side of the chest. So it's a pyramid-shaped space between those two parts. And of course, it forms the gateway to the body, a gateway to the upper limb, providing an area of transition between the neck and the arm. So when you're trying to transit actually from the neck to the arm, especially the upper arm, you're going to find out that this space exists. And of course, when you raise your arm, you're going to see the space completely exposed. When you raise it down, you're also going to see that the space is actually, quite constricted. So it helps to transmit important nerves, especially of the upper limb, transit them from their beginning point in the cervical region and then transmit them smoothly and in a protected form to the upper limb. So we're going to look at what exactly forms the boundary of this space. The boundary of this space is divided into six parts. We have the apex. As you can see, I hope you can see my arrow. This is the apex of the axilla. And then look at the base of the axilla. Of course, everything that has an apex should have a base. And then you have, the other boundaries or walls that are four in nature: the anterior, the posterior, you have the medial, and you have the lateral. The lateral is just in front of the upper arm. So this is just to show a kind of an imaginary space, on how the whole boundaries, get to form the entire axilla. So this is a diagrammatic expression to show all the entire boundaries and what it looks like, when we talk about axilla, the space that we have between our, appendicular skeleton and the axial skeleton in the upper limb. Now we're going to look at them one after the other. You have the apex, and this apex, remember that we established the fact that it is actually an inlet. It connects, the neck region or the cervical region, or trying to package the vessels, both nerves and blood vessels, and package them into the upper limb. So we call it an inlet. So the apex is an inlet. So if you say the apex or the inlet, or you can say more specifically cervicoaxial canal, because it actually transmits, more like a canal, especially through the axillary sheath, which we're going to see later. So the apex actually is directed towards the root of the neck. As you can see here, look at the apex, as you can see my cursor. And for that apex in particular, it also has its own boundaries. You can see here that it's quite related to the clavicle in the front, okay? And you can see that behind it, you're going to have the upper part of the scapula. And then medially, you're going to find the first rib, exactly the first rib. So that is the apex, the tipping point of the axilla of that pyramid space, okay? And then it transmits axillary vessels and the brachial plexus. And then when we look at the base is just, made up of the skin. When you try to close, the arm, the armpit, that's what we call conventionally the armpit. So when we try to close that space between your arm, the upper arm, and the exoskeleton, which is the armpit, okay, that is what we colloquially call it. But when we try to close it, you see that there is a kind of a touch between all the skin part that covers the whole of the region, laterally by the upper arm and medially by the sides of the rib. So that is the base. So basically the base is formed by the skin that stretches, from the anterior and posterior wall. So you can appreciate the anterior wall here, and also you can appreciate the posterior walls. So you can see that generally you are going to have that the skin covers, the medial part, the lateral part, the anterior part, and the posterior part. And just below it, you will find the skin of the arm, forms, a major part of the base, that forms the base of this piece. Okay, and then medially, you're going to have the chest wall also forming that base. Now we look at the anterior wall. Anterior is just what is facing you, what is in front. So in front, we can appreciate the P major muscle, a little bit deep in front. You're going to see, P minor lying just, immediately after it, still in front, as you can see from the second picture here. Now this is the P major that has been reflected, as you can see my cursor. Now you'll be able to appreciate the presence of P minor, which we can see, hidden. So you can also see the fascia, the little fascia that is here as well. And then you can also appreciate the subclavius. You can see the subclavius just lying immediately below the clavicle, and then you can also see the clavipectoral fascia as well. So that is the fascia you're seeing that is all over the place, the white patch trying to cover the muscles and connect them together. So this is typically what forms the front or the anterior wall of the axilla. Now, a little bit about the clavipectoral fascia. It is a very strong sheet of connective tissue. This is important because whatever happens, at the level of the fascia, you discover that when you have a fascia that connects more muscles or more structures together, it's also helpful, and at the same time it also has its own disadvantage, because when disease spread, it also spreads through that fascia. Same thing again when you also want to provide any particular kind of therapy, also follow that pathway because they are all connected. So you can see that the clavipectoral fascia, from the word clavipectoral fascia, is a fascia that starts, originates from the clavicle and extends itself throughout, other parts, of the pectoral region. So basically, it is called the pectoral fascia, and then you're going to see it touch, on the clavicle, and then just below the clavicle you have the subclavius muscle, and then you're going to see that same fascia continues, to cover as the fascia of this particular muscle, and then also extends the P minor, which is just below, um, or which lies posteriorly to the P major muscle, and then it continues further down and continues as the suspensory ligament of the axilla, and then tapers out through the floor of the axilla or the base of the axilla. So this is the clavipectoral fascia. You see it combining about three bottom muscles in the upper arm, and then tapers out as the suspensory ligament of the axilla. Now it is important that we also look at the posterior wall, because posterior wall is also one of the walls that leads to the gateways we can find in the axilla. Now, the posterior wall is formed by the scapula, is formed by also the subscapularis and the teres major and latissimus dorsi. Okay, and then we can see it here. You can see the scapula. This is actually, more like the back of the axilla. When we try to enter into that space, what lies, at the back of it, like what lies at the back. We've talked about the anterior wall. We've been able to see the apex and the base, and we're talking about the posterior wall. But it's important that we appreciate that there are two major muscles. These two muscles actually, the teres major, as you can see here, the teres major muscle, that's finds its insertion at intertubercular sulcus of the humerus. So you can see that that attachment, it quickly crosses, crosses the long head of the tricep brachii. Tricep brachii is a muscle that lies posterior, the posterior upper arm. In fact, the only muscle that lies there, and it has three heads. You have the medial head, you have the lateral head, and you also have the long head. Now, the long head is very important, in the posterior wall. You can see from its attachment right there, you can see that as it attaches, it moves on to find its space at the scapula, to find its distal attachment at the scapula, at the scapula, and then as it does that, it forms, about three spaces, in the posterior wall of the axilla. It forms three spaces, as you can see here: the triangular, the quadrangular space, and also you have the another space here that is also another triangular space. So it divides to form what we call gateways, or small spaces created by the teres major, the alignment or the positioning of the teres major, and the long head of the tricep brachii in the posterior wall. And when that happens, we're going to appreciate now, what the spaces looks like. So let's see what the spaces looks like. One of the first space that is created is a quadrangular space. This space provides a passageway for the nerves and vessels that are passing between the axilla and the more posterior scapular and deltoid regions. Okay, so you also have uh, the boundaries of this particular space. So this is the space we're talking about here. So you can see this space is typically, you can see the crossing of the long head of the tricep, and you can appreciate the teres major that created that space, alongside the long head of the tricep brachii. And then you can have the inferior margin of the subscapularis or teres major as the inferior margin. You can see the inferior margin formed by the teres major. You can see the lateral margin that is formed by the surgical neck of the humerus, and you can also see the superior margin that is also formed by the teres major as well. Okay, so this space is responsible, if you're doing dissection, the first thing is to identify where this quadrangular space is. And once you're able to identify it, you are most likely sure that you're going to be able to touch or palpate the axillary nerve and the posterior circumflex humeral artery and veins. Very important. So if you are trying to appreciate your dissection, try to note these spaces in the postural wall, and that will help you to navigate and be able to find, where those vessels are. Now, when we get to another space, another gateway that we can find in the postural wall, we have the triangular space. There are actually two of them, but the first one is the upper triangular space. We can see the upper one here. This upper one is responsible for transmitting the circumflex scapular artery. This scapular artery and vein, they pass into this space, and this space is formed. You can see the tendon. You can see the tendon of that's the tendon of the long head of the tricep brachii here. You can see it forming the medial border, and then you can see the superior border that is formed by the teres major muscle, and then you can also see the inferior border that is also formed by the teres minor muscle, or this minor muscle. Okay, so this is the space, the triangular space, and within it you will appreciate the circumflex scapular artery and veins. Now when we go to the lower one, this is the lower one here. Here it is named the triangular interval. We are still talking about the lower triangular interval, or the lower triangular space. Is a subtype of the triangular space. Now this one is also formed by the bone of the medial. You can also appreciate the long head of the tricep. Okay, so that you can see the shaft of the humerus on the as the lateral boundary. Then you see the long head of the tricep, and you can also see the teres major muscle also forming the boundary. What do you find here? You'll be able to find the radial nerve. The radial nerve passes through this space. So now we go to the medial wall. In the medial wall, The medial wall of the axilla is basically formed by, the spaces of the intercostal spaces within the ribs. So within each of the ribs, so this is a rib, this is a rib, this is another rib, another rib. You can see the first, the second, the third. Each of them, you see the first intercostal space, the second, the third, the fourth. So within this first three and the fourth, this is the entire, you know, um, axilla. I mean, this is the entire axilla here. I'm trying to situate with my arrow, I'm trying to situate this space, within, this particular picture. So you can appreciate that the medial wall is just, at the upper three or four intercostal space. So one, two, three, four here. So you're going to see it, lying from this point, down, up until the apex. Remember, from the apex to the base. So the medial part of that axilla is covered by the upper three or four intercostal spaces. And again, you also have the upper part of the serratus anterior muscle that are actually lying, on the medial wall as well, lying through. Remember that, the serratus anterior muscle also lies through the rib cage as well. And the long thoracic nerve, remember, is a branch, of a C4 branch of the brachial plexus. We can see that that long thoracic nerve is coming directly from the root of the C4 root of the brachial plexus, and then coming off to send direct, branches into the spaces to supply, the muscles within the serratus anterior. And then you have the intercostal branchial nerve as well, okay, that also forms part of that medial. So you can see the intercostal, which is a branch of the long thoracic nerve and piercing the medial wall as well. Now we look at the lateral wall. What does it contain? The lateral wall is on the other side. So by the arm side. So by the arm side, you appreciate the presence of the bicipital groove, or the intertubular sulcus of the humerus. Is a very popular impression you are going to find when you're using the bone to study. Especially you want to know the relationship of that bone, not just the bone itself, but the relationship of that bone to axilla, the relationship of that bone to the whole arm, and also to the vessels. When you also get, during a human dissection lab sessions, you'll be able to appreciate, the relationship between that bone and the impressions, that they have. So this is a typical impression that you're going to see that takes origin of several muscles. P major muscles is one of them, and then you also appreciate is the latissimus dorsi muscle and the teres major muscle also coming from there as well. And you can also see the coracobrachialis is also, coming from there as well. And of course, the short head of the bicep brachii muscle. So these are the things that form the lateral wall of the axilla. Now we look at the content of the axilla. What does it contain? We say it's a space, and if it's a space, definitely something is going to be there. So basically, it contains the axillary artery. You don't need to cram it, you just need to relate it. When you talk about axilla, is a space, that has axillary artery. Of course, when you try to touch that space more like touch your armpit, you're not going to be able to put the axilla, but we're talking about what we can find when we try to open up that space, right? Okay, so you see the axillary artery, its branches, you see the axillary vein and its tributaries. And very importantly, we're going to also find the lymphatic vessels, or the lymph vessels, the lymph nodes present as well. And you're going to also appreciate the brachial plexus, the nerve plexus, the brachial plexus, which is the most important, plexus of the upper limb. So these are the content. We start first with the axillary sheath. This sheath is actually what helps to, wrap this axillary, or the content of the axilla, and wraps and protects these vessels within the axilla. So it's the sheath. These axillary vessels and the brachial plexus are enclosed by the sheath. Just a fascia, the way you have muscular fascia, you have, for example, we mentioned the clavipectoral fascia, we mentioned the pectoral fascia. These are different types of fascia. So the axillary sheath is actually continuous with the prevertebral fascia, at the root of the neck. So this is the sheath, as you can see, the very circular thing here. And then within that sheath, you're going to find out that you have the terminal and the cords, at this level that you are seeing at this level of this incision. You're going to see that you have the axillary artery, you have the axillary vein, okay, and then you have the three terminal cords, lateral cord, medial cord, and you're going to the three terminal cords of the brachial plexus lie within it. And then you can also appreciate the relationship of the sheath, or rather the axilla itself, with the other muscles and with the entire, pectoral region. So you can see all the muscles and how they are positioned. So this is the rib cage. So this is more like a picture taken from up down. Okay. And then you're seeing the rib cage, you're seeing the humerus. This is the humerus, seeing the scapula, and then you'll be able to appreciate, that space called the axilla at this point. Now, another picture for you to be able to appreciate the axillary sheath more, and you can also see the three terminal cords, the posterior cord, lateral and medial cord. You can see the axillary artery, and then it's important to note that the axillary vein, lies away from the sheath. So look at the sheath here. Then you're seeing the axillary vein, even though it tends to follow, but it lies a little bit away from the sheath. And then you have the very closest muscle to the sheath is the P minor muscle. You can see it more clearly here. Now we look at other contents of the axilla, the major content, which is the axilla. If you want to appreciate what it looks like, I intended to use this also for us to appreciate this artery. And axillary artery, as we all know, is a continuation. You can see the vessels, the blood vessels we see at the neck region gets to continue and find themselves, advancing into the upper limb. So here from the aorta, you can see the branches are actually what give off, what we have as the vessels of the upper limb. So it's a continuation of the subclavian artery. So at the point of the neck, you say it's subclavian artery, but when you come to the upper limb, it changes its name and becomes axillary artery, simply because of its function. Because at that point, it's actually, supplying the axilla, right? So it's a continuation of the subclavian artery. And again, this is going to begin at the lateral border of the first rib. So this is the first rib here. So this is where it begins. Okay, it's actually divided into three parts. So the first part is where we're talking about, where it begins. So look at the subclavian artery here, where subclavian ends, and then this is where axillary begins, the first part. So just at the lateral border of the first rib, and then it ends at the lower border of the teres major. So first rib and teres major are the typical landmarks from the beginning and the end point of the axillary artery. And again, it continues, as the brachial artery. So subclavian artery, axillary artery, brachial artery, they are all the same. They only change their name depending on where the part of the body we're talking about. And again, closely related to brachial plexus cords as well. So you can appreciate that they are enclosed with the cords within the axillary sheath, as we saw in the axillary sheath as well. And again, we appreciate that P minor is what actually divides them into three parts. So you see that the P minor muscle is actually, I don't think it's quite clear here. Okay, let me see. There is no, we can appreciate the division, but it's the P minor that divides them into the three parts. Okay, the way the P minor is aligned, that divides them into three parts. Now, let's start with the first part. The first part extends from, like we said initially, the beginning of the first part is also the beginning of the whole artery. So from the lateral border of the first rib to the upper border of the P minor. Okay, the first border, this is the mark. This marking you're seeing is the first, the first part. So from the lateral border of the first rib to the upper border of the P minor. Now we want to look at the relation, of the first part of the axillary artery. Anteriorly, it is related with pectoralis major. You also have the covering fascia. Let me pick up my cursor again. 1 minute. Okay, it's related by the P major. You also have a covering. You will not appreciate it here because this is already deeply dissected, so we can only see the arteries. But you can imagine that the P major is going to lie here as well. And you also appreciate the skin that covers it. And of course, anteriorly, you also appreciate the cephalic vein, which is a superficial vein that lines at the border of the deltoid muscle. And then posteriorly, you're going to have the long thoracic nerve. Remember the long thoracic nerve that supplies the arteries anterior that forms branches that enters into the intercostal spaces, to supply that muscle and the space as well. And then laterally is going to be related with the trachea of the brachial plexus. The second part of the axillary artery lies behind the pectoralis minor. Remember, I said P minor is usually the landmark that divides, these three parts of the axillary artery. So you can see the P minor here. We can appreciate it a bit more here. The last one I was trying to show the relationship for the first axillary artery. And I was trying to, talk about, the muscles that are quite related to it. The second part, lies just behind. You can see the artery. Okay, here we can only appreciate the vein, but the artery is right here. The red thing you are seeing. So let me pick up my cursor again. So, sorry, I'm going to pick red. Okay, so you can see that red vessel there. You can see the blood vessel there. So that's the axillary artery. So that is exactly, the P. This is the P minor muscle. So you just line the part that is lying just posterior to it is the second part. Now the second part is also related anteriorly by P minor and the major, P minor and P major, of course, and also the covering fascia and the skin. Posteriorly is related by the posterior cord of the brachial plexus, and laterally by the lateral cord, medially by the medial cord, and the axillary vein as well. Now we'll go to the third part. The third part is the part that ends up to continue as the brachial artery. So this third part, as you can see it here, extends from the lower border of the P minor. Remember, the P minor lies just on the second part, on top of it. So it separates the first, the second, and from the third. So it's lying on top of it, then separates the first from the third. Okay. So extending from the lower border of the P minor to the lower border of the T major, that's the teres major. Okay, and then when we talk about the relations, it's related by the P major muscle as well, medial root of the median nerve. The posteriorly is related by the subscapularis muscle in the posterior part. Of course, subscapular is that muscle that is just lying, at the subscapular space of the subscapular fossa of the scapula, and then the latissimus dorsi muscle as well as the teres major muscle. These are the posterior relations. When we talk about the lateral, by the lateral side, you're going to have the coracoid brachialis. Here, the muscles have already been reflected, so we can appreciate the muscles. And then the humerus as well, related to the humerus, of course, you can see the humerus here, and you can see the third part of the axillary artery. Okay, and then we also have medially related by the ulnar nerve, axillary vein, medial cutaneous nerve of the arm as well. Now, we look at the branches of the axillary artery as a whole. It gives off different branches at different parts. At the first part, you have, highest thoracic artery branch. The second part, you have thoracoacromial branch. This supplies, towards the thoracoacromial end of the scapula, and also gives off the lateral thoracic arteries as well. And then you also have the subscapular artery coming up from the third part, the anterior and posterior circumflex humeral arteries as well. Things you can appreciate. So when you look at this picture, you'll be able to take your time and find this relation and try to know the branches from each of the parts. First part, the second part, and the third part, you'll be able to identify, for example, the circumflex. You can see the posterior circumflex femoral arteries from the third part. You can also appreciate the subscapular artery as well. Look at the subscapular artery as well. You can see it right here. Okay. And then we look at the axillary vein that moves. Remember I said it moves away from the fascia but still moves alongside the axillary sheath. Okay, it's a continuation of the basilic vein, just like we have the axillary artery being a continuation of the subclavian artery. You also have the axillary vein as a continuation of the basilic vein at the lower border of the teres major. So it runs, look at the axillary vein here. So just right from here, you have the subclavian vein, and then you also have the axillary vein coming on. So it's a continuation of the basilic vein, and coming on, and then becoming uh, and coming further, down and further down. Okay, so at this point it's subclavian vein, at this point is axillary vein, and then it continues as the basilic vein. Remember, for the artery, still subclavian artery, axillary artery, and then uh, uh, brachial artery. So the same pattern. Okay, you're having subclavian vein, you're having axillary vein, and then you're having basilic vein. Okay, the only difference is that for vein we have basilic vein as the later continuation, but in axillary artery we have it continuing as the brachial artery. Okay, so it runs upwards on the medial side of the axillary artery and ends at the outer border of the first rib, and where it becomes the subclavian vein. And then you have tributaries as well. It gives off tributaries of the cephalic vein. This is one of the tributaries that just lies just very close to the deltoid, muscle. And then you have other veins that, corresponding veins that, it gives off with other branches of the axillary artery. Now we want to look more closely at the axillary lymph node. This is also one of the contents of the axilla, but it's good we study because you can actually be asked to, because of its implication, the role of the axillary lymph node, especially as it relates to the breast, the lymphatic system, the immune system as a whole is very important. So it's good to understand, the axillary lymph nodes, and how, they are positioned. So we're, as part of the content of the axilla, we're looking at it and, more in more details to understand, how the lymph nodes are, how they are, their subdivisions, and how they work. So basically we have about 20 to 30 lymph nodes, within the axillary lymph nodes. Okay, lymph nodes is just part of the organs of the lymphatic system. So they are lymphatic vessels themselves. They basically do the more like they clean up. Let me use that word. They clean up. Some clean up the fluids, in the body tissues, in the cells. What they basically do is that, they work with the cells and the tissue within the body and the cell tissues to, clean up. So you have a circulation, just like we have, nervous circulation, just like we have the blood circulation. We also have a circulation of lymph. This lymph are fluids that helps to wash away and take out unwanted, materials from the body, that digest them, and be able to have some level of immunological function within the whole body system. Okay, so they are arranged in 5 groups. We have the anterior group, or you call them the pectoral group. You have the posterior group, you have the lateral, you have the central. Because typically, it's as if the way we have, the walls of the axilla is also the way we have. The only difference is that we don't have a central part, and we also don't have the medial. In axillary we have the medial wall, right? But here we don't have the medial, medial group. What we have rather is a central group. Okay, so while we have 6 walls, or 6 boundaries, sorry, 6 boundaries, in the axillary artery, we have here 5, major groups in axillary lymph node. These are typical anatomical divisions. Okay, because you might also see some other forms of which we are going to see in the course of this lecture. So anterior group here, the groups are divided based on, not necessarily based on the way they function per se, but based on their relation, their close relation, and their position, their region. So there is a regional division. Anterior group are usually called the pectoral group, okay, because they supply the pectoral region. Okay, they are responsible for playing that immunological role at the pectoral region. Okay, so they basically drain the skin and skin and the muscles of the anterolateral aspect of the abdominal wall, usually superior to the level of the umbilicus. Okay, and then the lateral quadrants of the breast as well. So it basically converts the lymph to more central nodes. We're still going to see that, and partly to the apical axillary node. So this is the typical anterior. So look at it here. This is typical. You can see it right here with my cursor. So basically, they are located across the inferior border of the P minor muscle and the superior border of the P major muscle. So this is the P minor muscle here. Okay, then you can see their location. That tells you, what it does. And this is the bone. This is the clavicle. Scapula is just behind it, and then this is P minor, and just below the P, beside the P minor, you're going to appreciate its location, and this is why it's called the anterior group. They're usually 4 or 5 in number, and they are large nodes as well. And then when we talk about the posterior group are also known as the subscapular group. They are, remember, the subscapularis muscle is behind, so it's more like it's anterior to the scapular bone, but is posterior to the axillary to axillary region. Okay, so it's also called the subscapular group, and they are found anterior to the subscapularis muscle, so usually around 6 to 7 nodes. Okay, so you can see it here, the posterior nodes here. You can see them here. Is denoted as 5, but it can be up to 6 or 7. Okay, they drain the skin. They usually drain the skin and the muscles of the posterior neck and the upper back. Okay, because they are posterior, so they drain the posterior neck and the upper back. So sometimes they drain as far as, the back as far as inferior, as the superior border of the iliac crest usually. Okay. Now, the lateral group, the vast majority of the lymph vessels from the upper limb actually drain into this group, except maybe the lymph vessels that accompany the cephalic vein, which usually drain the lateral aspect of the upper limb and flow into the usually the infraclavicular nodes. Okay, so largely you should note that the vast majority actually drain into this group. So this is the lateral group, usually about 4 to 6 of them, and found to be posterior medial to the axillary vein. Okay, so you can see it here, the axillary nodes, okay, or the lateral nodes. Some people call it axillary, but it's axillary because it's seen as more like where almost all the lymph vessels drain into. So others drain into it, so it is called axillary nodes. Okay, but in anatomical division, we call it lateral nodes. Now we look at the apical. The apical is also one of the most important group, of nodes in terms of drainage, because they also receive lymph from all the 3 groups as well, just like we talked about in the lateral. They receive from the anterior, they receive from posterior, they also receive, from the lateral itself. So that is why it's also called central. Okay, this is the most important. So it consists of 3 to 4 nodes. It's found at the base. The base, look at it right here. So just at the base and the center of the axilla. So you can see the relationship with the P minor muscle. Okay, so you can see it interspersed amongst the adipose tissue of that region. Okay, now we look at the apex, the one that lies at the apex, the apical group. The apical group is also called the subclavicular group. They consist of 4 to 5 nodes. They lie look at it right here. Is the apical group just below the clavicle, subclavicular. So we also can call it subclavicular as well. They lie at the lateral border of the first rib and they extend to the apex of the axilla, medial to the axillary vein. So they receive, vessels, lymph vessels from their other axillary groups as well. Most of them get to receive from each other, but like we said, central remains the most important. Again, it's important to note that for the apical group, the nodes on the left side, actually drain into the thoracic duct. So that's why it's a larger form of lymphatic vessel. Whereas the nodes on the right side, within the right side, the apical node section, they drain into the right lymphatic trunk. Now we also have the infraclavicular nodes. I'm just bringing it to your attention, but you need to know that they are not referred to as axillary lymph nodes as well, but just for you to know. Okay, they are because they're located outside the axillary fossa and outside also the axillary region generally. So usually a group of 2 to 3 nodes that you will find. Let me see if I'll find them here. Okay, look at them here. So they are infra. So we don't see them as by region. We don't see them as belonging to the axillary lymph nodes. But it's important to learn them as well because you also discover that sometimes they drain into one another. You see infraclavicular lymph nodes draining into the axillary lymph nodes as well. So these ones, they drain the major muscles of the forearm. They also drain the hand, they drain the arm, as well as the superficial lymph vessels of the surrounding regions as well. Okay, and this space is also where the cephalic vein passes as well. Now we look at a clinical grouping. This is for those of us that that will use it in the future. When you are looking at the clinical assessment of the axillary lymph nodes, especially assessing metastasis, cancer metastasis, or any tumor related to the breast or spread. We normally consider the lymph in this way clinically. We have the level 1, usually based on the relationship to the P minor. We have level 1, or what we call the low nodes. We have the middle nodes, we have the upper nodes, based on their relationship, whether they are lying inferior to the P minor, or whether they're lying behind, or whether they're lying above P minor. So let me show you another. We also have what we call the Rota's nodes, or what we call the interpectoral nodes, that lie between the P minor and P major. Remember, the other one is about the level 1, level 2, level 3 is about the relationship, between P minor. But now the Rota nodes are nodes that lie between the P minor and P major itself. Now this is also another form of classification that also includes the level 1, level 2, level 3 we have talked about. And then you're also going to see other forms of classification like internal mammary lymph nodes, supraclavicular lymph nodes, and making it about 5. So in this picture, you appreciate that the B, C, and D are axillary lymph nodes. The level 1 nodes are the point B, and they're usually the closest to the breast. Then the level 2 at the point C, they are usually further from the breast near the upper arm. And then the level 3 at point D are also the axillary nodes that are actually very far away from the breast. Okay, point E is the supraclavicular lymph nodes. You can see it close to the neck. They are above the collarbone usually. And then the F is the one that is the internal mammary nodes. They are usually located near the sternum or the breastbone, as you can see right here, just at the sternum. Now I want to appreciate, okay, before that, generally the notes I've shown you, the classification we will prefer are the 5 classical classifications that are anatomical divisions. Those are the ones that we use, but for clinical purposes, we want to appreciate the level 1, level 2, level 3 nodes. It's good you understand them to be able to see how we view lymph nodes, especially related to its function and related to diagnosis as well. So clinically, the axillary lymph nodes and the axilla is usually related to the breast cancer. We normally, the knowledge of it helps us to understand metastasis, especially with lymph nodes, And of course, breast cancer, usually treated either by removing the lumps, or removing the whole breast, which we call mastectomy, or removing the particular lumps, at the breast. Okay. Now we also have lymphoma. Lymphoma is a type of cancer that can actually affect the entire immune system, including the lymph nodes as well. So when that happens, even some of these axillary lymph nodes will also be affected. We have the Hodgkin's. The difference, between Hodgkin's and non-Hodgkin's is the presence of what we call the Ritzenberg cells. When this tumor, there is a biopsy that has been made, biopsy has been done in that particular tumor, be able to, examine, whether there is a presence, of these cells, histologically. And when that is proven, we can now say that it is actually a Hodgkin's lymphoma or not. So red stem back cells, typical, shows that you're having one is having a Hodgkin's lymphoma. Okay, so it's a characteristic feature we look out for. Now we talk about lymphadenopathy is also the enlargement of one or more lymph nodes, which can be a symptom of various underlying conditions. Usually, they are that, I mean, the lymph nodes are usually small organs, that help to fight infections and diseases. And sometimes, in a range of factors, like these infections can actually cause it to swell, because they have tried to clean up and they have also accumulated a lot of bacteria, virus, fungi, and when they do, they actually get to swell up. So it's more like a response that you're going to see, more like physical response. Sometimes you touch your axilla, you're going to see something that looks like lumps all over, as you can see in that picture, right? So these lumps could be a response on what you call swelling of the nodes. It's a simple swelling of the nodes. So this is a typical enlargement or one or more. So it can happen at this region, whether at the apical, whether at the pectoral, whether at the posterior, whether at the anterior, wherever it happens. And sometimes you notice that after a while it goes away, especially when there is no disease indicated. So in the presence of even cancer, in the presence of autoimmune disorders, in the presence of viral infection, bacterial infection, any presence of any disease, you're going to see this usually happen. We also could have what we call the axillary abscess. Abscess is usually a collection of pus. Now, when they start having pus, like you can see in that picture, pus formation, usually under the arm or in the axillary region at any of the, axillary lymph nodes, is also typically a sign of infection as well. Usually, Staphylococcus aureus, usually implicated in bacterial infection. Okay, so this is what we need to know that are very, very important, to the axillary and to axilla and the axillary lymph nodes. Now we want to take a look at some of the sample MCQ questions that will let me see, how far we are fared so far from this lecture. And let me ask, what are the structures that make up anterior wall of the axilla? Let's see whether we have learned something. I'm going to give you some time now. Just reflect. Is it A, is it B, is it C, is it D? What are the structures that make up anterior wall of the axilla? Remember, we have about, 4 walls with an apex and a base, so we have 6 boundaries. So what are the structures that make up the anterior? And we say the anterior is facing you, what you can see, when you just, get into the axilla. The one in front is as simple as that. Okay, the answer is A, P major, clavipectoral fascia, and P minor. Now, what are the structures that make up the posterior wall of the axilla? Posterior wall, what can you see? Behind, remember? Behind, what can you see? Once we talk about behind, we remember the scapula, right? Because that's the bone that, makes that boundary. What can we see? Subscapularis, T major, and latissimus dorsi. I hope you got it. And then, anterior group of axillary lymph nodes lies along the, let's see who will get that, that's very easy, lower border of the P minor. Apical group of the axillary lymph nodes lies along the, are you sure what you're thinking right now? It lies along, behind actually, behind and above the P minor, and also medial to the axillary vein. Remember, the apical group of the lymph nodes, they lie behind and above the pectoralis minor. Remember, P minor tells you the boundary dividing the axillary arteries. That helps to tell you the location, Even if you don't know it, it helps to tell you the location of the axillary lymph node because those are the apex are closely related to the scapula, sorry, through the clavicle. Okay, so medial is the axillary vein, and behind and above the P minor. So the answer is E. Which of the following branches of the axillary artery supplies the pectoral muscles and the thoracic wall? Very simple. Lateral thoracic artery. Which of the following branches of the axillary artery supplies the head of the humerus and the shoulder joint? Okay, the final one. Should I leave you to answer this? Okay, the answer is posterior circumflex humeral artery. Thank you very much. And I look forward to your questions whenever we interface. And also, you can reach out to me directly for any confusion or any clarification that you might need. And all the best. See you in my next class.